Hello and welcome. It's another episode of Health Matters on Channels TV. Thanks for joining us. I am Mary Alale Yusuf. When physicians talk about cardiovascular disease, they are describing diseases of the heart and the blood vessels. The World Heart Federation says that cardiovascular disease kills 17.3 million people every year. 80% of these deaths occur in low and middle income countries. About 7% take place in Africa. The Federation is convinced, however, that 80% of premature deaths caused by CVDs or cardiovascular diseases can be avoided. Coronary heart disease, or coronary artery disease as it's sometimes called, results when smooth elastic arteries become narrow and rigid. Our guest on the show is Dr. Akinsonya Olusegun Joseph. He's a consultant cardiologist at the Lagos University Teaching Hospital, Idi-Araba, a member of the Pan-African Society of Cardiologists, and also a member of the European and American Heart Associations. You're welcome.
Thank you very much. Thanks for inviting me.
Let me start by asking you, what causes coronary heart disease or coronary artery disease?
Okay. Well, coronary artery disease has a lot of causes, a multifactorial disease, and like you have actually said, it's actually a clogging of the blood vessels of the heart. There are so many risk factors. We divide them into modifiable and non-modifiable risk factors. The modifiable risk factors are things that we can control, and they account for more than 80% of the causes of coronary
So we're
artery
actually
disease.
saying that 80% of cases we see didn't have to happen.
Yeah, really.
And okay, it narrows. What's narrowing? What's narrowing the passage? What is hardening the artery?
Okay, well, so many things. The commonest is cholesterol. We talk of atherosclerosis. That's when fatty tissues clog the coronary arteries, and then what you see is that the passage becomes narrower gradually, and so many things can cause that. High cholesterol diet, hypertension is a major factor here, and hypertension affects over 30% of Nigerians as we speak. Okay, in some environments up to 45%. All right, now diabetes mellitus is also a major risk factor here, and hypertension, diabetes, increased cholesterol level, that's hypercholesterolemia or dyslipidemia. The three of them go together, go hand in hand, and they are like, three deadly silent illnesses. Now, smoking also comes into the mix. Smoking, is a major risk factor. Obesity is a major risk factor. Physical inactivity or sedentary lifestyle. All right, and if you look at the trend of our society, we're getting more sedentary. A lot of mental work, but less physical exertion, less physical activity.
But people have said that if somebody has a heart problem,
right,
he shouldn't really bother with so much exercise because it will exert him and make matters worse. Isn't that true?
Well, yes, at the acute phase, but prevention-wise, exercise is a major, preventive modality, okay, for preventing heart disease. If you exercise regularly, five times in a week, 30 minutes per day, it can actually reduce your blood pressure by more than 5%.
When you say exercise,
yeah,
what kind of exercise are we talking about? Gym, lifting weights, or just walking?
Now, what we tell our patients, or what we tell people generally, patients or clients, okay, is that you can start with isotonic exercises, things like walking, brisk walking, jogging, skipping. Okay, if you're the outdoor type, you can do swimming. All right, these are things, and we don't want you to get to the point of exhaustion. All right, go the level that you can. My exercise capacity may be different from yours.
But you're supposed to get winded, aren't you? Like,
Of course, you start. Yeah, before you get into the mainstream. I mean, you can do some light walk up, brisk walking, and then you can start with light jogging before the real vigorous thing. And of course, by the time you are getting to the point of exhaustion, there's no point, I mean, exercising and slumping. When you know that your strength can't carry it, you stop. All right, these are things that can help. For heart disease patients, there are graduated exercises.
So he has to talk to a physician?
Of course. Because the level, the main thing is that even before the patient is discharged, you are supposed to do what we call the 6-minute walk test, in which you're able to assess how far can this patient cover in 6 minutes, and you're able to prescribe the right, because exercise for us is also a kind of, medication. It's a non-pharmacological, medication. So you are supposed to prescribe the ideal, level or degree of exercise for that patient.
Okay, let me quickly ask you, does heart disease have any symptoms? What shows?
All right, fine. There are so many symptoms. The fact is that at the very beginning, the patient may actually be asymptomatic. I mean, hypertensives, a lot of them go around without any symptoms or very vague stuff.
If somebody is hypertensive, he has high blood pressure, does he already have heart disease?
Yeah, because, I mean, it's a risk factor that drives heart disease. But at the time the patient is coming, the patient may actually have established heart disease. Maybe the heart chambers may be dilated. All right. Blood supply to the heart may be getting compromised by the time the patient comes to us. All right. It's a risk factor, and it's also a driver of heart disease in this time. Now, back to your question, what are the symptoms of heart disease? I mean, for coronary artery disease, what we're discussing today, the main thing is exertional chest pain, usually retrosternal or left-sided.
Left-sided.
Yes, usually retrosternal or left-sided.
What do you mean by retrosternal?
It's just by the sternum, the central part, lower, just here, the central part. If the patient tells you, "Oh, I'm having chest pain here," centrally, it's not the abdomen. It's not. It's different from peptic ulcer disease. Although you need to be very, very skilled to be able to decipher which is which. All right, because peptic ulcer disease can also give heartburn. All right, so a good history by an experienced doctor will be able to tease out, is this patient really having this? So exertional chest pain, for example, the patient walks briskly up the staircase and then feels this pain.
Feels this pain.
Yes, and I mean, when the patient rests, "Oh, I need to take some rest now." When the patient ceases from doing what he is doing, perhaps lifting a bucket of water, if he discovers that I have this sharp chest pain, he drops the water, tries to relax, the pain goes down. That is classical of the very beginning of coronary artery disease, which is called angina pectoris.
Okay, just before we go on a break, I've heard that symptoms are a bit different in women.
Okay.
Is that true?
It can be different in women. It can be different in women, it can be different in the obese, it can be different in the elderly.
So there's a whole range of all sorts of things.
Yes, and in diabetic patients. They may actually develop, they may actually get to the end of the spectrum, which is myocardial infarction, without having chest pain or any of the symptoms. And we call those ones silent MI.
No symptoms. And then the person falls into heart
disease. I mean, heart attack, as the layman will call it. Okay, and I mean, some of them actually don't come out of it. I mean, I'm sure you might have heard of, maybe somebody in a board meeting and then suddenly slumps.
Slumps, and that's it.
And that's it. Okay, somebody's driving and then suddenly slumps, and that's it. And by the time you do autopsy, you discover that this patient has had heart attack. All right, so it can actually be symptomless, and that is a very bad one.
Let's take a quick break. We'll come back and we'll continue. Stay with us. You don't want to miss part 2. We'll be back in a minute.